Like most dads, Adam Hammond loves spending time with his baby daughter, something he never would have dreamed possible a few years ago. This former Army officer and member of the U.S. Army Golden Knights parachute team almost died after a skydiving accident while he was on leave.
I was slammed into the ground going 45 miles an hour. After hitting the ground, I just looked up to the sky and I said, "God, please don't let me die," because I knew this was bad. I broke my leg, my hip, my pelvis, my back, and tore several major arteries. I awoke from a coma 6 weeks later and was in chronic pain.
At age 26, Adam felt his life was over. He was forced to move back home so his parents could care for him. Except for visits to the doctor and physical therapy, he spent the next 2 years lying in bed or confined to a wheelchair.
I'd gone through so many surgeries, tried so many different medications, and each doctor I went to said, "This is the best that there is out there. If we can't do this, you're just going to have to live with it." But that was unacceptable to me.
Adam's spine surgeon referred him to interventional pain physician Dr. Timothy Deere. After a physical and mental evaluation, Dr. Deere recommended neurostimulation therapy to manage Adam's pain.
Well, good candidates for neurostimulation are people who have pain that's from a nerve origin, either in their limbs, so their arms or legs, or in their trunk, which could be the torso or the lower back. We put a lead like a cardiac pacemaker lead above the spinal tissue, and through that lead we conduct electricity to change the way the spinal signals are conducted to the brain.
The therapy is typically done in 2 phases, which allows the patient to try the therapy before moving forward with the permanent implant. This is conducted by placing a lead or leads in the epidural space that is connected to an external stimulator. Because the leads are temporary, patients must follow precautions. In general, patients are asked to avoid activities that could cause the leads to move, such as reaching, bending, stretching, or lifting anything heavier than 5 pounds. This evaluation period is often called a trial because it allows both patient and physician to determine if the therapy will be successful in managing the patient's pain.
After that they turned that device on for the very first time and it took 90% of my pain away instantly, I knew that this device was going to change my life.
After a successful evaluation phase, Adam underwent the permanent implant and became the first patient ever to receive the world's smallest spinal cord stimulator for chronic pain, the Eon Mini Neurostimulator.
Tell me where you feel the pain.
The patient may be alert during parts of the procedure, which allows clinicians to ensure that the stimulation is working to manage the patient's pain. Implanting the device is typically done on an outpatient basis with light IV sedation. As with any surgery, complications are possible. These can include infection, paralysis, severe bleeding, and persistent pain, numbness, or weakness at or around the implantation site. Additional complications could occur, such as allergic reactions to the device.
Going from the best shape of my life to the chronic pain was horrible. I thought that this was going to be the rest of my life. But I went out and I searched for something out there that could help me with my pain. And now I'm not in the best shape of my life. I won't ever be back to where I was. But it's enough to where I can walk down the street and no one will ever guess of all the surgeries that I've been through in my life.
Adam, good to see you.
Good to see you too.
How you doing?
Good.
Good.
More than 2 years after his implant, Adam periodically sees Dr. Deere for follow-ups. While currently there is no cure for Adam's neuropathic pain, neurostimulation offers him a chance to live relatively pain-free.
When I first saw Adam, he was in a wheelchair with his father, pushing him along. I looked at his medication list. He was on medications that I don't typically use because they're so potent. He was cloudy. He was very down with the quality of his life after his injury, which was horrific. He was basically hopeless. It certainly makes me feel wonderful to see a young man do that well.
To this day, the trauma surgeons say that there is no medical reason that I should be alive. And even one doctor said that because of the trauma, I would probably never be able to have children. And if you look at me today, I have a beautiful wife and a beautiful daughter. I'm a living proof that there is a miracle, and my life is only going to get better from here.
If you would like to learn more about neurostimulation, visit www.poweroveryourpain.com to access these resources. This story explains the experience of Adam Hammond with a St. Jude medical neurostimulation device. The results are specific to the individual featured. While most people experience at least some reduction in pain, The amount of pain relief experienced varies by individual. The surgical placement and/or use of a neurostimulation system pose certain risks. The occurrence of these risks also varies by individual.